Meanwhile, the state of Missouri is getting 50,000 doses of the single-shot Johnson & Johnson vaccine this week. But Michael Mahoney reports that will be the only shipment for weeks to come.
Increasing Missouri's vaccine supply is part of the plan to expand who can get a shot.
If this vaccine keeps picking up, we're going to be okay.
Governor Mike Parson Thursday in St. Louis. The state's director of public health, Adam Crumbliss, today. After this week, the Johnson & Johnson vaccine will not be here for the next 3 weeks. A consultant for the state's health department told them the 120,000 vaccine allocation for Missouri will also remain flat until late March. Missouri's pharmacies, however, are going to get more vaccine, 20,000 doses, to local stores, which might encourage some to get a shot.
Our pharmacists know their patients, they know their medical history, they know the drugs that they're currently on.
Missouri is now at the 15% threshold on people vaccinated. The major counties in the metro, however, are not on that pace.
What we really want to get to is where we can move into St. Louis or Kansas City or the bigger urban area and truly do, quote, a mass vaccine.
So the state's supply of vaccine will not increase in March as they expected, but they are still planning to expand the process, adding another 500,000 people in 2 weeks. Michael Mahoney, KMBC 9 News.
Local public health officials are also being told to prepare for another vaccine expansion in about 45 days. That would be about May 1st. As part of that visit in St. Louis this morning, Governor Parson got a firsthand look at the vaccination effort that's underway. He visited 2 mass vaccination events and stopped at Pfizer's Chesterfield facility. During his stops, the governor denied any favoritism toward rural areas, maintaining the vaccine rollout has been proportional across the state. And this afternoon, we know that thousands of Missourians are overdue for their second dose of the vaccine. The Missouri Hospital Association says more than 56,000 people have not received their second shot. Right now, people who got the first dose of the Pfizer should be getting their booster 21 days later. If you got the Moderna, the second shot should come 28 days later. Lenexa-based Heart to Heart International is working to vaccinate Kansas City's homeless population. Tomorrow, healthcare workers at the Hope Faith Homeless Assistance Campus will get the vaccine. Then the people they serve will get their shots at future events. Saturday, people staying at the Bartle Hall shelter will get the one-shot Johnson & Johnson vaccine. Meanwhile, Swope Health will hold a COVID-19 vaccination event on Saturday. To make an appointment, call 311 or 816-513-1313. Then select option 1. That event will be held from 1 to 5, and it's open to everyone currently eligible for the vaccine. A new partnership is helping to make the vaccine more accessible for low-income communities in Kansas City. Truman Medical Center, University Health is teaming up with KCATA and the city's housing authority to get people vaccinated. Today, buses transported about 40 eligible people to the TMC campus to get their shots. They were pre-selected by the housing authority. By removing the barrier of transportation, the partnership is addressing a critical need.
Everybody doesn't have transportation, so it's a big deal.
It's awesome because we have a lot of people that lives in our building. They're elderly. Some of them don't have rides. Some of them can't get out and things like that. So that helped us a whole lot.
TMC says the partnership will continue as long as there's a need. Anyone who has questions about getting access to a vaccine at TMC should call the hotline at 404-CARES. Kansas Citians struggling to pay rent or utilities can get some help now through the city's emergency assistance program. KMBC 9's Bianca Beltran was there for the mayor's announcement today. $4.5 million now available for that program. Bianca?
And Kelly, that money comes from a stimulus package passed by Congress in December and is being distributed to 5 local agencies that have been contracted by the city to provide immediate emergency assistance. And those groups include Metropolitan Lutheran Ministry, Journey to New Life, Restart, the Community Assistance Council, and Synergy Services. Each has received funding and is helping people with emergency expenses. Their goal is to prevent evictions and homelessness by helping people make ends meet.
But there are people saying right now, Mayor Lucas, I'm going to get kicked out of my place next month, 2 months later. So this is why we think this is such a vital bridge.
This immediate relief is affecting people's physical, mental health, and it affects their parenting, their relationships, everything.
And this comes as the eviction moratorium is set to come to an end. Kelly?
And we are going to go back live to Topeka now for an update on vaccination efforts in Kansas.
The announcement I'm making today goes a long way to closing the disparity in vaccine distribution. Today, I'm announcing my administration's new meatpacking workers vaccine plan. Much like our push to vaccinate teachers, counties with meatpacking plants will receive additional vaccine doses specifically earmarked for meatpacking workers. That will be in addition to the doses counties are already receiving from the Kansas Department of Health and Environment. All meatpacking workers who want to be vaccinated can be by the end of next week. KDHE is coordinating this approach with local health departments and directly with the packing plants to ensure this process goes smoothly. I know the past year has been incredibly difficult, and especially for our high contact critical workers like our meat packers and our communities of color. Today's announcement is another step in the right direction, just part of my administration's commitment to an efficient and equitable vaccine distribution plan. Finally, before we move on, I want to recognize our esteemed lineup of speakers. With us, we have representatives from our Hispanic and Latino communities, the meatpacking industry, and our agricultural industry. I sincerely thank each of them for all the work they've done over the past year, whether that's been keeping our food supply chain up and running or ensuring that our Hispanic and Latino communities have access to factual, timely information about COVID. And with that, I'm going to hand it back over to you, Enrique, to kick off the rest of the program.
Those are great news. Thank you so much, Governor Kelly, and thank you for keeping Kansas safe. We really appreciate it. Now I'm going to speak to Mr.
You are listening to a live update there from Topeka on the vaccination progress there in Kansas. Meanwhile, the Kansas Department of Labor is once again making changes to help you get answers to your unemployment questions. The department is increasing its call center staff to nearly 1,000 workers. The governor is bringing on another 500 surge employees and extending the center's hours. The system will also undergo a major server upgrade March 12th and 13th to support that extra staff. KMBC 9 News is working to answer your vaccine questions. For the latest vaccine news, to learn when you qualify and tips for signing up, just go to kmbc.com/vaccine.